I would like to thank you for sending in this case. It looks like I didn't have any instructions, but I make the assumption that it's tooth number 19. And it looks like you've done a pretty good job of marking the nerve. I went through that. It looks very nice. The first question I'm going to ask is, what is our restorative plan? Is it for a single tooth, a very large tooth, a small tooth? And I know it's a little bit of a facetious question, but the question is there because the implant seems to be placed randomly without a regard for a final restoration. And the reason I ask is based on this look here. If we go to the implant align view, based on this look, you know, in an ideal world, the implant is set into the tooth, so we would have a molar that is this wide plus that wide on the other side. So if we would use our measuring tool, we're essentially trying to say that we're going to have a molar that is 4 millimeters wide plus the width of the implant, which is 5 millimeters, plus then another 4 millimeters. So we want to have a molar that's basically 13 millimeters wide, which quite honestly, as we know, is probably about somewhere in the 4 millimeter ballpark too wide. So the implant definitely needs to be moved away. The best way to know this is ideally is with CEREC data, implant built into occlusion. The second best way would be a scan appliance with the barium sulfate tooth in there. The third best way would be to guess, which obviously we want to try to avoid. So let's address that, and let's take a look at another option to try to understand the size of a tooth that we can put here. So what I would like to do is a little bit of a trick here, where I'm going to measure tooth number 30 on the opposite side. And so we're going to measure that to be about, say, 10 millimeters wide. And so that'll mean that in all likelihood, tooth number 19 should be about 10 millimeters wide. So we'll go with that and make that about, say, 10 millimeters wide or so right there. And we'll use this as a basic centering line. So what we're able to see here is if we were to follow this line right here, our implant is much to the distal of this line. Our implant should probably be somewhere in that ballpark right there. So this is not the most accurate way, but certainly it's better than nothing, and it certainly does a very good job of illustrating the point here. So again, we definitely want to have the implant more centered. So in this case, we would simply move the implant over probably to about right there, and that's probably a more appropriate mesiodistal positioning of the implant. Now, based on that, again, without having the true data here, my guess is going to be that this implant is centered pretty nicely. We can hesitantly use the upper lingual cusp as a guideline and see that this implant is probably placed in the right position based on the fact that we have a big anatomical submandibular lingual area here, a lingual concavity here. I would say we could certainly consider putting a 10 millimeter implant in. That would be my ideal preference. You know, maybe placing the implant probably about right there. I would be very comfortable personally going to a 10 millimeter implant in this particular case. So, you know, I think your plan, generally speaking, is good. I would definitely move that implant over to the mesial, more close in approximation to tooth number 20, and then go from there. The next question I would have for you is how are we going to have a guide made, or if we're planning on having a guide made, because we can't see that here. Based on the data that I see here, a guide is not a possibility. Certainly this could be free-handed, so that exists as well. So again, thank you for sending the case. Hopefully the little trick I showed you there on the measuring tool is helpful. And if you have any other questions or would like to send additional cases, feel free to do so. Thank you very much.